Welcome to the Functional Medicine Foundation's podcast, where we explore root cause medicine, engage in conversation with functional and integrative medicine experts, and build community with like-minded health seekers. I'm your host, Amber Warren. Let's dig deeper. Welcome back, everybody. We're so glad you're here, and I am so thankful to be talking tonight with Kaitlin Cooley, who I have known since the inception of your career, which has been so fun. So tonight we're talking about the provider-patient connection in functional medicine. Kaitlin Cooley is a board-certified family nurse practitioner providing primary and acute care for all ages, from neonatal to geriatric patients. A Boise native, we love that. She played collegiate softball at College of Idaho, where she earned a bachelor's degree in health sciences. She later obtained her nursing degree from Idaho State University, and after working as a registered nurse, pursued a family nurse practitioner degree from Northwest Nazarene University, graduating with honors. Kaitlin focuses on individualized, patient-centered care and is working toward her functional medicine certification. She enjoys outdoor activities with her husband, Matt, and their 2 sons. Welcome, Kaitlin.
Thank you.
Thank you for being here.
I'm so excited to be here.
Yay! So I love this topic, and this is one that we haven't been able to really do kind of a deeper dive into. And you're such a wonderful practitioner to interview about this topic, because I know you are so heart-centered with your patients and you really take it very seriously to connect well with all of your patients, because I've been able to witness it. So I know that. So why is that relationship so important?
I think that relationship is everything. That matters before we even talk about your symptoms.
Yeah.
Because if you don't connect with your provider, you don't feel like you can, open up and tell them about your history, your family, your traumas, the way you were born. We talk about A to Z in our first intake appointment. So if you can't connect with that provider, then there's going to be gaps in your care, because we're not going to be able to get to that deeper level of understanding who you are.
And the vulnerabilities that come with really understanding what's going on in your life. Yeah, that's awesome. So how do you get it? I have had this experience, as I'm sure you've had, where patients, they're not ready to go there. They're not, because they've never had this type of setting and experience where they have a provider that really wants to get to know them and ask all the right questions. So how do you develop that relationship and rapport and trust?
Okay. It can be hard for some people. Like you said, some people have a hard time doing it. But I think first and foremost, when a patient walks into my clinic, I want them to know they matter.
Yeah.
You matter. Your history matters. Your hopes matter. Your dreams matter. So we start there. What's most important to you? How are you feeling? When was the last time you felt well? And so we'll just start with those basic questions. If they're not ready to go deeper, I'm like, okay, tell me what did you eat last night?
Yeah.
We can start so basic. We can start very surface level. I joke about my new patient intake questions. I'm like, okay, this is 50 questions. This is the 50 question exam. We're going to start basic, and then you tell me when you're ready to go deeper.
Yeah, that's great.
So we just start wherever they're ready to start, and then we dig deeper.
I love that. Yeah, I had in some of my initial training, in my early training of functional medicine, a guy by the name of Tom Malter, who has written several books on nutrition and detoxification, and how he approached his patients, and I love this as I watched him do it, was, where do you want to be a year from now? Where do you want to be 5 years from now? How about 10 years, maybe 20 years from now? And I love that, because it really does help patients be, a lot of people don't ever get asked that question.
Yeah.
How do you want to feel? What do you want your health to look like? What do you want your relationships to look like? What do you want your outlook to be?
Yeah.
So I love that approach, and what you just said reminded me of that.
That's great.
So how about developing the long-term relationship with clients? Why is that important? And how are you successful with that?
Because if we don't check in down the road, who knows, having that accountability partner, if we're not checking in, sometimes people just find themselves going back to what they've been doing for the last 35 years. So we'll make that initial appointment, and then we might usually get labs. We'll follow up. And then in that second visit, I usually feel like things are so much less tense. We're looking over the labs, we're looking at the changes that need to happen, and then we're like, okay, here are some very concrete things that we can make a difference for, make changes. And then when they come back the next time, so, they'll make those changes, and then 3 months later they're coming back, and we're checking in to see how they're doing. So we make appointments. We have at FMI, I think this is one, in my interview, I even said this to the people who interviewed me here. I'm like, this is what I love about FMI is we have health coaches, we have nutrition coaches, we have wellness techs. We have so many people to interconnect us to support one another. Yeah. So sometimes, we'll get people set up with their health coach, and then they'll see them in between when I follow up with the patient so that they're checking in and making sure, are you feeling better? Are these changes that Kaitlin recommended moving the needle for you? And if not, then that nutritionist will send me a message, you know, can we add on a continuous glucose monitor for this patient?
Our nutritionists are so good at that.
They're so good.
They're so involved in the care.
Yes.
They act more like us, which I love. I've never worked with a team of nutritionists and health coaches that we have here that are completely integrated with the patient care and act as a partner, like just an extension of us.
Yep.
They're incredible.
Yeah.
Yeah. I love the approach.
And I think the other thing that's cool to know is that we can use insurance to use them in their nutrition appointment a lot of times too. Yeah. So sometimes people are like, oh, it's kind of a burden to continue doing these appointments. Let's space them out. I'm like, okay, well, let's go see the nutritionist who, like you said, will step in and be a big part of what I do.
No, it's so amazing.
Yeah.
So how do you utilize, I know we're all a little bit different in how we utilize specialty functional medicine tests, laboratory analysis, certain biomarkers. How do you utilize those in your care and treatment of patients?
That is a big question that we can look small or large at.
Yeah.
I think I like to first start at just like the conventional typical testing that we do. We're looking at cholesterol, we're looking at your liver and kidney function, your thyroid function, but we're looking at how to optimize those numbers. We're not just saying, okay, your testosterone needs to be greater than, what is it, like 285 or 300 or something, whatever the conventional testing says, something ridiculous that we're not even going to think about.
Right.
And then we're going to hone in on what are the optimal levels for you, your goals, your age. And so we use those testing markers to find what would be optimal to help you get that energy or, help your mood. So we use those first of all. Again, I do a lot of primary care, so I'm doing a lot of annual wellness exams where I'm using the wellness labs that are typically ordered, and then we add on to that. So when we're going to really use those wellness labs that you're going to get covered no matter what. Well, most of the time, no matter what.
Right, yeah. Be careful what you say.
Yeah, exactly.
It's still the insurance world.
I always say you check with your own insurance.
Yeah.
So we're going to use those. And then after that, we can add on, let's look at some stool testing. Because if your stomach or your mood or your eczema is still XYZ, let's look deeper. Let's look at some stool testing or some environmental testing. And so I think that's the cool thing about functional medicine as well, is we use these more advanced markers to look deeper and on an individual approach. So not everybody needs stool testing.
Right.
Not everybody needs hormone testing, but we have the ability to use those to look deeper.
So if someone comes to you for their preventative annual wellness exam, whether it be they want their annual exam done, it needs to be done for work, needs to be done for sports, needs to be done for insurance, you're individualizing all of those visits as well.
Yeah.
So you're asking those questions.
Yep.
Digestive symptoms, hormonal symptoms, energy. So it's not just checking the box of wellness.
Right.
You're actually doing kind of a deep dive in that visit. Yeah.
And I have to keep it,
I know.
Insurance
you have to play the rules.
Approved. Yeah. So, I have all these basic questions like, how are your bowel movements? How's your mood? How's your exercise? I have just bullet points of, let's just mention those. And then should we need to dig deeper, then we have some time to dig deeper, and then we can do a follow-up appointment to look over the labs that I ordered in that annual wellness exam. Does that make sense?
Yep. Yeah. Love it. So you're doing a lot of functional stool analysis, so looking at the gut microbiome.
Yeah.
You do hormone testing. What kind of hormone testing do you do?
So a lot of times I'll start with the estrogen, progesterone, testosterone.
So blood.
Yeah, blood. Cool. And then depending on results, sometimes I'll refer them out to people who that's their bread and butter, like women's health or you. We'll just start with the basic markers and then go from there.
Yeah. Is there anything that you, as the more experience you get in functional medicine, that you like to focus on? Or what you would consider a specialty in your area?
I call myself just the primary care gal.
That's awesome.
That's what I love to be full family visit. I love to be able to see, your 2-month-old and I like to see the mom. And then the mom comes in and the day she's there, she happens to bring her 5-year-old with her. It's just fun to be family medicine oriented in a functional setting.
I love that so much.
I love it. I'm so thankful that I get to do that here.
Well, and that's also like, let's go back to what we talked about in the beginning, just developing the rapport, the relationships, the trust. When I don't do primary care anymore, and I do, like, you're reminding me of those days when it is so fun. You feel like you're a part of their family.
Yes.
You watch the kids grow and you watch the health changes happen, and it's like you're part of their journey, and it's really, really special. I love that you're offering that out of our Boise clinic.
Yeah, me too. And the other part is, like, I know what this mom or dad or this family, I know that they had mold in their house. So I know when this kid comes in with his ear infection that maybe there's something deeper. You know, there's so much value in really forming that relationship with your provider and getting to have, the whole family come see me.
And I love that we're having this conversation, because I think there are probably a lot of our community members out there that don't know that we really do this side, because we've spent so much time on this podcast talking about the deeper dive, right? Talking about mold, talking about PRP, talking about the musculoskeletal system, brain health, hormonal health, metabolic weight loss, that I think it's really important for people to know that we have this as an offering.
Yeah.
We have someone that can do this general overlook, the primary care aspect of it. You have an ear infection and you don't want to just be written a script for antibiotics. We have these services at our Boise and Meridian clinics, and that's so huge.
I want to shout that from the rooftops, honestly.
Do you?
Because I've recently actually opened up certain visits to only have acute visits.
Oh, I love that.
I've blocked them in the day because I'm starting to have more people want to come see me as functional visits or wellness exams, but then we're kind of missing out on those acute visits, which is what I feel like is almost my bread and butter, is doing more of that, like urgent care, primary care. I'm here to help you in those streps or you know, coughs, all those things. So we're making sure that we can provide that to the community.
This has been a dream of mine for years. And Sam and I have talked about this, and we've talked about it with some other colleagues and team members here at FMI, but I would love, and I think, detail-wise, it's difficult to try and figure it out, but I would love to have a functional medicine urgent care in this community. Yeah. Whether it's us or we join forces with someone else. How cool would it be that on a Saturday morning, you are not only subjected to have to go into an urgent care setting or a hospital setting for a cough, for a fever, for an ear infection, for who knows what it is, right? Like, to be able to have supplements at your disposal, or homeopathy agents at your disposal, without having to rely on the conventional system and antibiotics and always medications. 24/7. Like, I would love to be able to offer that to our patients in our community.
Well, right now, Monday through Friday, we've got that.
Yeah, we do have that. That's true.
We're here for that.
But I'm more worried about the Friday night through Monday morning at 5 a.m. issues.
I love that dream.
That patients don't want to have to rely on the more. And I'm not bashing the conventional system. I'm so thankful that we have such a wonderful conventional system that offers life-saving care. But there's just so many options out there for people that could be utilized. So I need to return back to that dream. I've gotten a little sidetracked, but I need to return back to that and see if that's something we could make a reality. Are you looking for high-quality supplements? FunMedShop.com is carefully curated by the wellness experts at Functional Medicine of Idaho. You'll find high-quality supplements to support your health and optimize your body's natural functions. Rooted in responsible sourcing and utmost commitment to purity ensures that you're getting products that are not only effective, but also safe and reliable. Plus, you'll find our own line, Functional Medicine Foundations, which is carefully formulated using the best ingredients available, so you can trust that you're giving the body the support it needs. Visit funmedshop.com today and take the next step in your health journey. That's funmedshop.com. So you do pediatric medicine?
Yeah.
Okay, so what kind of things can we offer in peds that maybe on this same topic that the conventional system can't offer our pediatric population? Well,
like you said, we have alternatives to, strep throat. We have I should go back. We have alternatives to sore throats, coughs.
No, but I'm okay with you saying that. I understand that's a very controversial topic.
Yes.
But it's personalized medicine, and it really depends on the patient, the family unit, the severity of the strep infection.
And I educate. Yes. So I say, here's level 1. Here we can start with X, Y, and Z. Yeah. Should you develop these symptoms, it continues for these days, then we're going to turn to a different way of treating it. Right. And that again, I'm just so passionate about being able to provide that to the community because it's such a need. Yeah. And I have these moms come in and they're like, wait, I am so thankful that you just said that to me. I've never had anybody give me another option for my kid's ear infection.
Absolutely.
And I just feel like right then and there, it's like this, like this moment that I get to connect with the mom of like, there are options out there and I hear you.
Yeah.
And I think our patient population, there's so many amazing parents out there who are just diving deep to find how to provide wellness to their kids. Yeah. And I love that we get to help provide that to them. So, I'm a part of Facebook, like mom groups on Facebook.
I was just going to go there.
Yeah.
Yes.
And I just I scroll and it hurts my heart to listen to these moms say things like, are there any pediatric providers out there that won't shame me for not doing the typical things that are encouraged at child visits? And so many moms are like, don't even do it. Don't even go see any provider. Don't, nobody will listen to you.
Don't trust anyone in the system. All doctors are bad.
Don't sign any papers. Yeah. And it's just like so many people have been hurt by medicine that I'm like, okay, there's another alternative. Please, go create a relationship with a provider. So, there's two things to talk about there. Even if your kid's not sick, you should still utilize your well child checks because you're going to create that relationship, just like I said at the beginning, with a provider who knows you and knows your kid.
And knows your preferences.
Yes. So then when your kid's battling with really bad eczema and he's like itching himself all night long and keeping both of you guys up, we know what your diet is like. We know this holistic approach to it. Yeah. And we know an alternative way of treating it. We still have options of using steroids, and we still have options of doing things that you might do once you end up going to the urgent care because your kid has scratched themselves so badly. But we have already established that relationship, and we've laid that foundation of lifestyle approaches that will help your child in the long run, right? And then number 2, should something really go wrong, you already have a relationship with the provider. So if you need to call in and, message in and say, this just happened to my kid, do I need to go to the emergency room? You have a sounding board of a provider to run that by. And same with utilizing your well child checks. I think that's great because, again, a lot of times our kids are just healthy these days, like especially our patient population who are
aware.
Well aware of what to do. I think it's so fun to just bounce ideas off of with the parents, off of the parents back and forth. Like, I'm thinking about craniosacral therapy, or, I'm wondering about my child grinding their teeth at night. And then I have resources of, here's some really great dentists in the Valley, or here's some really great craniosacral or acupuncturists. And we get to just have those conversations and just throw ideas back and forth with each other.
Because by the way, you moms and dads out there that have taken a proactive approach with your children and their health, you are brilliant. I learned so much from young moms and dads, not even young, even those with adolescents kids going to college. The research you do, I am so encouraged by so many of my patients that are parents or thinking about becoming parents, and just the approach they're taking with their children's health, because we're all going against the grain of what society wants to do to our kids. I think I can say that. Even today I shared on my social media, they're changing the names of food dyes.
Yes.
They're becoming harder to recognize. And that is, I'm just going to say it, the work of the devil. It's not okay. Talk about a message that needs to be shouted from the rooftops, and something in the legislation needs to be done about that, because they're going after our kids. I think they're starting, and I'm not going to define who they is, but I think they're starting to learn that they're having a hard time going after us because of awareness, and people are starting to wake up. So they see our children as an easy target, an easy marketing target, an easy ploy. And I probably shouldn't keep going.
I get it.
But we have to be the advocates for our children. And my saying for a while has been, my kids don't belong on the front line of this. I won't put them on the front line of all the different things that are going on in our world and in society. I will be the mama bear to protect them from this. So what are things, I love that we're going towards kind of a pediatric conversation, because this is what people want to talk about and want to hear, is the health of their children. So what are some of the current issues or health issues you're seeing kind of most common in our pediatric population?
I would say a lot of like ADD, ADHD symptoms, skin symptoms.
Yep.
Gut symptoms. Well, I guess gut kind of encompasses it all.
It does, doesn't it? Yeah.
But like GI symptoms that they're actually complaining about. And then I think there's this pull, again, like you were just saying, from the, how do I phrase this? The mainstream food and the mainstream medical communities. And then from the more functional side of things. And so I see there's like very two different sides of populations of children I'm seeing. I'm seeing the ones that are proactive, and I'm seeing the ones that aren't proactive.
But they're coming to you. They're still seeking functional medicine care.
And I think we're starting to see a lot more of just like, okay, my sister's brother had a really good time with their kids being seen here. Or like, my boss said that they had a really good time here, but they don't fully understand what functional medicine is.
Right.
So we are still seeing a lot of people who aren't doing lifestyle changes that we typically recommend.
Right.
If that makes sense.
Yeah, it does.
So I'm seeing that like there's a lot of really healthy kids that I don't see very much in, other than like they're here for a cough or they're here for congestion that won't go away. You know, like I see two sides of things.
So what do you think? You just listed a good constellation of symptoms that you're seeing, 6 or 7 issues. What are some of the most common root causes of those symptoms that you're seeing?
Gut, like we said.
Okay.
So what is the root cause of gut? We've got environment. We've got the food that we're taking in. We're talking about stress. You know, we're under a lot more stress than we really realize we are. Even if it's just like your 7-year-old child, you don't think he's under a lot of stress, but he takes in everything. He takes in relationships. He takes in school. He takes in like everything that you're stressed about, he can be stressed about too.
Yeah.
Right? So we've got, what was it? Nutrition, environment, stress, and then I think that's probably about it for the GI
No, I think that's great. Yeah.
Yeah.
I mean, the sterile environment that our children are born in.
Yes,
right?
Yes.
Loaded with things in the hospital in those first 2 to 3 days of life that impact their immune system, therefore impacting their gut microbiome. And I think we can just look at what's going on like day one.
Yeah.
We know the data is very obvious that it's the first 3 years of life that like set the stage for your gut microbiome and your immune system. So that's been my dream and why I'm so excited that we've built this like robust pediatric functional medicine department, because we really have to start from day one. And really, if we're really looking at population health, it's starting with conception. And we have this wonderful women's health team, and we have a team that's wonderful at helping to optimize mom's health before she even gets pregnant. And that's really what needs to happen.
I'm having a lot of those conversations with women already, just who are coming in for their wellness exams, not like seeking out women's health, I'm just here for my wellness exam. And then we talk about their future plans, and that's one of their future plans. And so I'm like, okay,
here we go.
I'm looking at your symptoms here.
Yeah.
They're looking like there are a lot of GI stuff here.
Yeah.
So let's focus on, optimizing your gut before we set up baby's gut.
Yeah.
And then also talking about the mental load, while you're pregnant, and how that is conveyed through baby as well.
Yeah. We had a great conversation, go back, 9-10 episodes ago with purpose-driven chiropractic, Dr. Christy, and she talks about the nervous system and how important it is to get mom's nervous system calmed down before you have that baby. And it is, I'm so glad you touched on that, because that's gold.
Yeah.
And I talk a lot about too, I think we forget that, like you were talking about environmental insults and how that interplays with gut health and the immune system. And I think we forget that these environmental insults that we're seeing, whether it's the food dyes or glyphosate or right now the air quality, what a stressor that is to our body.
Yeah.
So it's not just the psychosocial, psychological stresses that we see with politics and screens and pressure on children and the 15 different sports they play every year. It is the toxic burden and the load that we see in our bodies too. That's a huge, I tell my patients, like, your vitamin D deficiency, your vitamin D of 13 is a really big stressor on your body, because that's a pro-hormone, and vitamin D has so many different benefits to the body, right? Or your progesterone levels that are non-existent, that's a huge stressor to your overall system and your overall hormone imbalances. So I think it's also just reframing that conversation, because our patients don't want to hear you're too stressed out. Well, what am I supposed to do? That, like, it's really hard to have that conversation with your patients without stressing them out more.
Yeah.
Because they're like, I don't know how to de-stress. That's my life. And I'm like, oh my gosh, I get it.
Yeah.
But starting simple and giving them baby steps to take,
Yeah. Even literally 5 minutes of like stillness.
Breath work.
I tell people that all the time. Okay, yeah, you are busy, but I'm pretty sure you can five, 10 minutes to just sit, be still, whether it's praying, meditating, or breathing, you can do it.
Yeah.
That's just step one. We got to get your body out of fight or flight and into rest and digest. And so we give them these like very baby steps of ways that we can get you into rest and digest, because that's huge.
I love that. Starting your day with the sunshine.
Yes.
And not your phone.
Yes.
Like that just sets the stage for the day. You're right. It doesn't have to be an hour per day. It's so
I
good.
just told a mom the other day, I'm like, you know what? I literally take my toddler, I bring my coffee, and I sit on the front or the back porch, wherever the sun's hitting you.
Yeah, exposure.
And like, just let him crawl around on the grass while you're just sitting there.
Yeah.
Soaking in the sun.
Yeah.
Breathing in the fresh air. Mm-hmm. Boom. Mm-hmm. There's step one that we can make.
Mm-hmm. I love that. Yeah. Is there anything else that you think is even just in the last few years that is dramatically impacting our children?
Screens.
Good.
No question. Screens. They're everywhere.
Yeah.
When we go to restaurants, we're handing our phones to our kids to be quiet. Or even when I'm seeing moms come in for their appointments, I'm like, here's some coloring crayons for your kids.
So good.
Here's some blocks.
Yeah.
Let them play.
Or tongue depressors.
Yes.
Let them play with tongue depressors. Can we talk about what happened to the crunchy books that we when I had babies?
Yes.
I mean, maybe that was eons ago and I'm old, but my babies had the crunchy books or the black and white books. That's what I would hand them. I don't see toys or books anymore.
Yeah.
Because it's a screen.
Yeah. And I don't want this to sound judgmental in any way. It's just this is what we do in today's day and age. We have screens everywhere.
Yeah.
So I don't, if you're coming in and your baby's on a screen, that's okay. If that's what you want, that's fine.
Yeah.
But
and maybe that patient coming in that's the only time that baby gets a screen is it so mom can have a doctor's visit.
Yep.
So I agree.
Yep.
Not being judgmental and assuming that that's just the go-to is not fair for us.
No.
For us to do. But
that's everywhere is my point is we have to stop. We have to there's research, there's conventional research everywhere about how bad these screens are for our kids. So that's something I feel like I have to touch on.
Mm-hmm. Yeah. The 7-year-old that has their own iPad.
Yeah.
I just can't figure it out. Mm-hmm. It is so wild.
I can figure it out. It's it keeps your kid sitting there quiet, doing something else while you're cooking dinner.
So you can get life done.
It makes life easy.
Yeah.
But then when you tell him to turn it off and it's time for dinner and he's throwing it and so angry, that also, that doesn't make life easier. Mm-hmm, mm-hmm. And I don't think we make those connections of what's actually happening when we're giving them those screens.
So there might be people listening right now that aren't actually aware of all the research that's out there because they're not in childhood education or development or in medicine. Mm-hmm. So are you aware? Can you talk about maybe what it does to the brain, not even just the pediatric brain, but the brain in general, but especially these developing brains?
I mean, I can't quote exact research.
Nope,
but
I wouldn't ask you to do that. Yeah.
In short, I did just read research about how, I think it was 3-year-olds. If you gave 3-year-olds a screen for an hour a day, how it ended up having more tantrums than those who didn't have screens. Yeah. And then overall, just, we're thinking about the light that's being put on their eyes as we're trying to get ready for bed. Yeah. It's disturbing their circadian rhythms. Mm-hmm. That's as far as I can tell you, the exact research of what I know.
No, yeah.
But I know,
spot on.
It's just hindering brain development.
Yeah. I know I've been having a lot of conversations lately, just getting back into school mode, right? And getting these kids to try to calm down and go to bed at a reasonable hour because they get up early. I'm like, what's it going to take to get these schools to start later? Yeah. Because we're, especially adolescents that we know need 12 hours of sleep, right? We know those kids need that much sleep, but they're the ones whose schools start the earliest. Mm-hmm. They're catching buses at 6:30 in the morning. They're getting home late from either sports or their job or activities, 9:30 at night, sometimes still having to finish homework.
Yeah.
It's interesting. I tell a lot of my, adult clients, I'm encouraging them to maybe diminish, we haven't talked a lot about 5G and EMFs, but to try and diminish those levels in their home and environment. Mm-hmm. But so many of my adult patients say, well, my kids are on it till midnight, so I can't turn it off before I go to bed. I need to leave my Wi-Fi on because they're getting their homework done or they're doing stuff on their screens, which is a whole nother conversation. Why do they have screens in their bedroom? But it's just getting me in this mode of like, of course teenagers are struggling. Like we expect them to perform in their academics, athletics, activities all day and do it on 7-8 hours of sleep. It's insane.
Yeah.
It really is insane. And we're expecting them to do it 5 days a week. It's interesting. I learned this summer that in France, their kids, K through 12, go to school Monday, Tuesday. They get a break Wednesday to sleep and to focus on their arts, their music, their athletics. And then they go back to school Thursday, Friday. And their whole rationale is so they can get adequate sleep halfway through the week. And I don't think they start till 9 or 9:30 in Europe. And they want to give their left brain a break to be able to have their right brain get engaged halfway through the week. And then they feel like their left side of the brain can finish strong with their academics.
Makes sense.
Why is that so hard for us to try and understand?
Yeah.
So it's just got me in this mode of like, really, I think we're all in this mode of like, question everything.
Yes.
What's really best for our children? Why are we doing things a certain way? And why have we been doing that for so long?
Yeah.
And how could we maybe do something better? And again, if that's how your family, no judgment on your family, but like, what do I think my family needs?
Yes.
Or my children need? So yeah, I don't know how
that's really neat.
Isn't that cool?
Yeah.
To think about that? Like
maybe they're paving the way for us. Let's hope.
I sure hope so. But we haven't.
We'll get the research from them.
Yeah. But we haven't followed their. They don't spray their foods with all these organophosphates and pesticides that we do. So,
but a lot of us use their information to share with others.
Yeah.
They don't allow these makeup products in their makeup. They don't allow this in their food. So why are we? I think there's a lot of really good advocates out there right now that are trying to make those changes. But for now, I think implementing it in our own community is where we start.
Yeah, no, it's wonderful. And I think there is this wave that's starting to happen, like, a wave of alternative ways to school your children, alternative things to do. So many more homeschooling co-ops and different schools that maybe start a little bit later. You're only 3 or 4 days a week are starting to pop up. So
yeah, I have seen some of that.
Yeah, it's pretty cool.
Yeah,
it's pretty cool. Anything else in the pediatric world? Any other tips and tricks? Let's go there. I know our audience is so desperate for tips and tricks for children, whether it's improving gut health, improving how we can feed our children at home, getting rid of screens. What else are you recommending, like in these well child visits that you're doing?
Food dyes, like you mentioned.
Yep. Okay.
Avoiding
Good.
the food dyes.
Love it.
Being active. Let's get them out and playing. Let's get them in the dirt. We talk about, exposure to the soil, exposure to the grass. And again, clean grass, avoiding the pesticide sprayed grass.
Be careful at the park when you see the guy spraying the big thing on his back. Maybe don't go let your toddler run around in the grass.
Yeah, and I talk about other types of toxins too, like artificial fragrances and what you're putting like in your laundry soaps. And just clean foods. We talk about, if you can, ideally eat organic. Depending on symptoms, everything's personalized in what I do. I don't do anything like everybody should do this.
Yeah, good.
But like based off of skin, so maybe avoiding some certain types of food that are more inflammatory types of foods. And I think that pretty much sums it up what we've discussed.
Good. I love it. What do you think in your arena, in the patient population you see, what moves the needle the most for your clients?
I think a low inflammatory lifestyle. And
tell me more. What does that mean?
That depends on per person. So again, inflammation comes in what you're putting in your body, what you're putting on your body, what you're exposing your brain to. So I think just like basics, how are your relationships? Are they toxic? Are they inflammatory? How are your foods? Are your foods inflammatory? Whether that is processed foods, sugar, gluten, dairy, what's your body sensitive to? And then movement. Let's make sure you're moving your body. And then environmental exposures. Inflammatory environmental exposures. So just in general, I just like to think of the idea of like what's inflammatory in my life and how can I limit that or avoid it.
It reminds me what you just said, and you are spot on and you are so accurate in what you just said, but I think a lot of people would say, I don't even know where to start.
Yeah.
Everything you just said is so overwhelming in today's day and age. It reminds me of this little image I saw. This was months ago, but it was a little kid driving one of those little cars. Remember like those old school cars with like the little black horn?
Oh, yeah.
Again, you don't see these kind of cool things anymore. That's what kids should be doing. But, and he's on a freeway and there's like 300 cars behind him, right? And a lot of the cars are labeled like pesticides and screens and technology and EMFs, right? And it's basically like these poor kids can't get out of the way of all these insults that they're seeing, right?
Yep.
But yeah, I think you just laid out what I call my non-negotiables that everybody has to at least be aware of.
Yeah.
No one's asking for perfection, but the awareness piece of what you just said, right?
And sleep. I don't think I mentioned sleep. Sleep is
Love
huge.
It's
I know
huge.
you mentioned it, but that's the other thing.
Doing your best to make it a priority.
Yeah.
We're not asking you to get 8 to 9 hours every single night, but make it a priority.
Yeah.
Get blackout curtains.
Yeah.
Cover your eyes, mouth tape, put your screen down an hour before bed. Just do what you can to make that a priority.
Maybe some magnesium.
Love magnesium before bed at night. Honestly, magnesium all day.
I know.
Like let's just put magnesium in the water, not statins. Let's put magnesium in the water because it calms everybody down.
With every baby shower, we should bring Rest Max to
should,
in a present to people.
Here, Mama, here's what you really need.
Ignore everything else.
Yeah.
Here's some Rest Max.
Yeah, it will really help you, and it's safe. Thank you, Kaitlin. You just spoke so eloquently and beautifully, and I think there's so many people from all different walks of life that will glean a lot of really great takeaways from this message and this conversation.
Yeah.
So Kaitlin sees patients Monday through Thursday. What days are you in clinic in Boise?
Monday, Tuesday, Thursday.
Monday, Tuesday, Thursday, because she gets to be a mama, which is so amazing. So check out Kaitlin out of our Boise clinic. Thank you, Kaitlin.
Very much.
Thank you for listening to the Functional Medicine Foundation's podcast. For more information on topics covered today, specialties available at the FMI Center for Optimal Health, and the highest quality of supplements and more, go to funmedfoundations.com.